So let's turn to some concrete examples now. I'll hand it over to Tia to talk about lessons from BHC.
Thank you, Han. And Paul's paper, over landscape paper, is like, it's like so 5 stars. I made it required reading for everyone. So I just like really just jump into it. It's incredible. I am going to talk about some of the lessons learned by the California Endowment through building healthy communities. Let's see, okay, here we go. So first, I know Tony spoke with you all, and I believe most folks are familiar with the California Endowment's 10-year Building Healthy Communities project. And this strategy really was focused on 14 neighborhoods. So in many ways, it looked like a very targeted place-based initiative, but it had a different twist in that, unlike, say, a service saturation place-based strategy like the Harlem Children's Zone or a specific inside-outside systems change, this really focused on power building and policy and systems change. So the theory of change was that if you built power among residents, they would push for policy and systems change, that the policy and system change would then improve the opportunity environment, would change those social determinants of health. And then there would be a lag, right? But eventually you'd see population level health status change. But even this is a timeline of TCEs Journey. One thing that I want to just give enormous credit to both all of the partners, which is what TCE calls their grantees, the leadership and the program managers of TCE. So all of these different color lines at the bottom reflect the enormous amount of kind of innovative experimentation that was going on underneath this. TCE adapts and learns at a really quick rate. And that can be frustrating if your job is, if you're interested in really getting to something right, it's a really beautiful, beautiful process. So even this, if you see right here at 2013, even the 4-step theory of change actually didn't come into later. It began in 2010 with something that looks very much like sort of a traditional place-based initiative, albeit one that's grounded in social determinants. They had 4 big results. Reverse the childhood obesity epidemic, increase school attendance, and reduce youth violence. This should sound pretty familiar, but and they began to, the drivers began to get a little bit clear about how they did the work. And the drivers changed include things like people power and youth leadership and narrative change, collaboration and policy innovation. All of that led up to kind of 2013 with this consolidation of those drivers of change under the moniker of power. What we're going to talk about today is how we get from that 2013 change to where we are today. And where we are today is the foundation is centering grassroots power building. Okay, so after the development of that theory of change, the next kind of move that happened after years of learning was kind of a restating of what their North Star goal was. And the North Star goal began, like the mission, kind of our vision was health equity equals health justice for all. The North Star goal, the leading light, was building voice and power for healthy and inclusive California. And remember, before we talked about policy and advocacy change, so we talked about power and understood there were multiple approaches and methods. At this point, the foundation had learned that what it wanted to center was grassroots power building. And grassroots power building for racial justice must be primary. So yes, you had more grass tops efforts, and yes, you had legal and policy advocacy efforts that were really important. But what was at the center was grassroots power building for racial justice. And this involved a flipping of the script from early on. Okay. From early on in prioritizing grassroots and funder relationships to prioritizing grassroots leadership. Okay, so this is a quote from USC. This was a midterm evaluation that was a big part of moving towards this North Star goal. During the first half of building healthy communities, an emphasis has been on achieving health equity through professional advocacy and communications effort, bolstered by community voice and mobilization. The health equity equation should be flipped and should lead now with community organizing, leadership development, and grassroots advocacy, and then bolster these efforts with professional advocacy and communication. So what was at the center changed. This involved the elevation of power building from a secondary instrumental driver, a way you got to health equity, to a primary driver and ultimately an end in itself. Four important lessons emerge from this. The first one is the evolving definition of people power. When BHC began, really the definition of people power was resident engagement. It was basically residents who are affected by things show up and they give input, they bolster public debate, they influence policy decisions. And the role of community was really bringing people to the board meetings, the Board of Soups or the city council, or, you know, it was getting people to events. And it was also an idea that power equaled just the aggregation of a lot of individuals' efforts. Okay, so get more people coming up and testifying equaled more power. And in terms of the foundation's role was, listen, we're going to set the results and outcomes. Okay, we're coming in with those four big outcomes, right? And then we're going to give it to the community to figure out how they get there. So that was sort of the splitting up of role. Almost immediately, 2011 to 2015, the understanding of what power looks like when exercised by community gets more complex and more subtle. It becomes an idea of resident agency. So instead of a bunch of individuals, you know, all giving their voices, it looks at residents collaborating collectively to shape campaigns and programs that cause policymakers and system leaders to respond. So this is much more agentic. It's much less responsive, right? And also it implies that you're going to need to have organizations. You just can't have individuals out there, that there need to be strong organizations which are preparing and building the skills of folks to come up with different policy agendas, to exercise power, to recruit more members. So the role of community then changes from residents give input to residents and their orgs possess agency. And the foundation moves from, you know, we set the goals, you come up with the how, to these kind of foundation created tables where it brought different folks together. It brings the grassroots system leaders to collectively build solutions. By 2016 and 2018, we see kind of the next shift to the seeds of people power. And this is really about going from residents kind of shaping campaigns and putting out their ideas and not simply responding, to actually kind of the orgs leading, and them leading in the strategy process. So the seeds of I am running behind. Okay, seeds of people power. So community-led initiatives gain traction, find their stride, and begin to flex their leadership to shape their own issues and approach. So this is suddenly what happened before then. Remember, TCE had set the goals. Now the community orgs were blowing those goals up. They're saying, actually, no, we think you should be doing this. We actually think that you should be doing healing justice. You should be doing work in schools that's different than truancy prevention or chronic absence. And BHC becomes less the foundation created table and the node for residents. Finally, we go to the power building ecosystem, which is the next part. And I'm going to move very, very fast now. My apologies. The idea of power building was that it's recognition that if we center grassroots groups, that alone having those orgs there, that they need to have kind of an ecosystem of allies around them. So they need to be supported by a robust ecosystem of diverse disciplines. And this is the quote from the USC article: organizing and base building alone are insufficient to influence those who have the authority, resources, and power to make the kinds of decisions that will improve the lives of historically excluded people and reduce inequities. A broader ecosystem of orgs with diverse capacity, skills, and expertise, and with reach from local to regional to state levels required to get to the big goal of justice, health, and justice for all. So again, the organizing and base building groups were in the middle. We're not saying, oh, we don't need advocacy, we don't need research, we don't need leadership development, but then all of these groups were around this to support this, and this is called the flower power. The next lesson is we realized that a petal was missing, and we represent this petal here by the sun around healing and personal transformation support. So what does healing and personal transformation supports have to do with building power? The idea here, and this again was learned through grantees and the back and forth that happened with program managers, that while structural change through power building is always imperative, removing or reforming harmful structures will not automatically undo the psychological, spiritual, and physical damage done to our bodies, souls, and minds over generations. It will not address how we are wounded internally by systems, history, and each other. Without attention to healing, organizers, advocates, and community members can turn on one another or turn on themselves and self-destruct. Rage can motivate us, but it also can destroy us. And if turned on our colleagues and allies, it can undermine a movement. Healing-centered movement building enables the most impacted and hence the most hurt by oppressive systems to fully participate as advocates and leaders in the movement by proactively addressing their past and current internal wounds, while at the same time building the critical consciousness needed for them to interpret the world and act to transform it. I believe we're at 1 minute, so I'm going to just go very high. The fourth lesson had to do with narrative change, really moving from our narrative change beginning with sort of a more traditional, almost kind of norm shift, social norm media piece, where TCE usually took the lead and worked with big media consulting firms, to pushing this to understand that the work is really led by the community and needs to be embedded in those. It's actually a part of power. It isn't separate from power. It isn't communication strategy. It's something that needs to be embedded deeply into it. So this is moving from, moving towards establishing narrative change as an essential component of community organizing, and really moving from having this kind of more top down, where you have the big media firms doing it, to really figuring out how we create a petal on the power flower, right? This cadre of cultural strategists and narrative changers rooted in historically marginalized communities who can build, right? Who can help to build that capacity inside those power building orgs. Ultimately, what this reflects is, this is the grassroots policy projects. Comes from Luke's, I think I'm saying his name right, the three faces of power, and they've adapted it, this idea that the three faces of power, the power to win demands, the power to drive the agenda, and the power to shape common sense. And how this kind of translated to TCE's new kind of next 10 years is power to win demands equals centering people power as the engine, power to drive the agenda. This is building power requires more than strong organizations. It requires that robust ecosystem. And the power to shape common sense is putting narrative strategy in the service of grassroots power building. And then our final piece is, this led TCE to really completely rethinking their role as a governor, as a funder. Going from sort of telling, leading, or power over, not transparent or consistent, either too close or too far, to letting the movement lead, having power with grantees and right relationship, a feedback loop, listening and adjusting, being involved at the level and the ways the grantees value. Measuring success goes from shiny policy wins and rapid response, leveraging the insider track and superficial numbers, to systems transformation deeply rooted in the most impacted communities, generational change, and developing new metrics for authentic power building. And finally, the program manager competency, from strengthening individual organizations to learning how to cultivate a robust ecosystem.
Ooh, thank you, Tia. I didn't think I could find anyone who would talk faster than me, and you did. So my only regret is we only gave you 10 minutes. Just incredibly rich information and analysis that you've shared. And we'll come back and have a dialogue amongst us just in terms of some of the findings.